The biggest misconceptions that I think urologists have about prior authorizations and denials is that many times there are actual rules that are out there and that are published that the urologists or the practices are just not aware of. And it's nicely spelled out in many policies. Medicare has a number of policies that are published online that explains specifically when something will be covered and when it's not covered. And us as well-meaning physicians that want to do the best for our patients, we figure out there's a procedure that would benefit my patient, which would be true in our own minds. But sometimes, especially when it comes to whether private insurers, Medicare, it needs to be proven in the literature before someone will end up paying for it. So prior authorization uh, works well if we make sure that we know what the patient needs to be prior auth for and that they meet the appropriate criteria. Yes, it can be a bit of a hassle. And yes, it can be challenging and frustrating, can delay care, but that's a whole nother topic. If we as providers all knew the criteria for patients based upon what is written in the literature, what is shown to be medically necessary and appropriate for patients, I think a lot of prior authorization problems would go away because we would make sure that we are submitting prior authorization for the patients that meet the criteria already. One of the most difficult parts about being a physician is that there are things that we believe are going to be best for our patients. One of the hard parts is to tell somebody that although we may in our heart of hearts believe it to be true, it's not proven in the literature to the point where an insurance company will actually pay for it. And that's a very tough dilemma for a physician that puts us in the middle between patient care and what's something that's going to get paid for.